Kerala's health minister recently appeared for a televised interview wearing a cervical collar. She explained the injury was the result of a physical altercation, a neck strain sustained when protesters pushed through a police line to reach her. While she wears the brace from that encounter, the local news cycle is dominated by daily demands for her resignation. Headlines across the state claim the health sector is in a state of total collapse, driven by accusations of systemic medical negligence. This local outcry stands in direct opposition to the view from the international community. Global health organizations and medical experts frequently cite Kerala as a model for successful public healthcare outcomes. This creates a strange contradiction: a single system that is simultaneously studied as a global success story and condemned locally as a catastrophic failure. Moving past the political headlines and examining the state's medical data provides a clearer picture of the system's actual performance. The health minister has a specific perspective on this media pressure. Before her political career, she spent 16 years as a journalist and served as a news channel's executive editor. She claims that certain local newsrooms operate with a targeted bias, even maintaining dedicated desks assigned to produce negative stories about the health department, often with basic fact-checking. The most damaging stories involve medical negligence, specifically cases where surgical instruments were left inside patients during procedures. To prevent this, the state utilizes the WHO Accountability Matrix, a global safety checklist designed by the World Health Organization to track every instrument in an operating room. Despite these protocols, human error remains a factor in high-pressure surgical environments. This chart compares the 647 recent medical negligence complaints filed across the state. Approximately 600 of these cases originated in private hospitals, while 47 were reported from government-run facilities. Although the vast majority of these errors occur in the private sector, the resulting media outrage is concentrated almost entirely on the government's public hospitals. Isolated errors in the public sector are often presented as evidence of a systemic failure, while the larger volume of identical errors in private healthcare goes largely unexamined. Away from the cameras, the state has been transitioning its local clinics into comprehensive family health centers. These facilities are designed to provide advanced diagnostics and primary care directly within the community. This upgrade program has expanded the state's medical capacity significantly. Public dialysis centers grew from 12 to 125, and a universal free treatment plan now covers 4.2 million families. The system's actual resilience is often tested by acute threats, such as Amoebic Meningoencephalitis, a rare and aggressive infection caused by a brain-eating amoeba found in fresh water. This chart shows the global baseline for this pathogen. On average, the infection carries a 99% mortality rate worldwide. By implementing proactive testing protocols the moment symptoms appeared, Kerala's medical teams reduced that mortality rate to 24%, a significant departure from the average. This rapid response approach is previously utilized by the state to contain the Nipah virus, where strict epidemiology and containment measures were used to lower expected death rates. A healthcare system that consistently mitigates pathogens with a 99% global kill rate does not align with the narrative of a system in collapse. Mritasanjeevani is the official state program responsible for deceased donor organ transplantation. Recently, the program was nearly halted by public mistrust. Baseless rumors regarding how doctors certified brain death led to a series of legal controversies and a drop in donations. The health department addressed the crisis by removing legal ambiguities and making the certification process fully transparent to the public. This turnaround highlights a broader reality. Medical infrastructure is only effective if it maintains public trust. Without that clarity, even advanced systems can be paralyzed. For the state, managing public health now involves two different types of containment: eradicating biological pathogens inside the hospital wards and addressing the spread of misinformation outside of them.